I'm really delighted to be here in Hyderabad, and thanks to Prabhat for allowing me to do that. It's been fantastic, even if there was an overnight flight to contend with a couple of days ago. So I've been involved with EvidenceAid kind of on and off from 2004, but I joined as a staff member half-time in August 2011 as the knowledge manager. And it's my responsibility to ensure that the information that we include on our resources is searchable, relevant, and available. The other things that I also do are I do a lot of the social media stuff for EvidenceAid. So if you follow us on Twitter or Facebook, that's me that you're talking to. I've been tweeting furiously this morning, and I hope that you're all doing the same thing if you can. We are also going to walk you this morning through the ways in which EvidenceAid provides information for the people who are preparing for and responding to natural disasters, humanitarian crises, and other major healthcare emergencies. So, as I said, this is a quick outline of my talk. So I'm going to talk about why we've got the resources. I'm going to touch again on the special collections that Mike mentioned earlier, give you some examples, talk a little bit about the website, both the old one and the new one, a little bit about social media, give you some stories, and then talk about the future. And it won't be as long as it sounds. So in terms of looking at the EvidenceAid resources, I started trying to put together all the resources in the different places that we had, and started kind of linking them up to each other. And I got as far as this and thought, actually, I'm not sure that this is terribly useful. But what you can see from this is that it is complex, and in terms of what we produce and how it's disseminated. And if you add in the confounding factors behind each section, then it's more complex and involves many different people and many different organisations. And in terms of other people disseminating our evidence, we're very, very grateful to people that help us to do that. I won't list them because we'll be here all day. So why do we have EvidenceAid resources? Well, the aim is to summarise and provide information to our users. After the 2004 Indian Ocean tsunami, as Prabhat and Mike have mentioned, we realised that there was no single source of information for people responding and preparing for disasters. And that was, as you know, how EvidenceAid was born. But our mission was to try and work out how EvidenceAid could help. So between 2004 and 2009, there were 4 special collections created, as Mike talked about, and these were linked to from the front page of the Cochrane Library. The special collections covered 4 areas. They covered earthquakes, flooding and poor water sanitation, burns, and post-traumatic stress disorder, which are referred to as PTSD. We also created web pages that were hosted by the Cochrane collaboration, but they had no brand value or recognition for EvidenceAid, as they had a slightly different focus. However, we didn't have anything else and we had no access to anything else, so it was really helpful to be able to have that at the time. And as a result of the needs assessment survey, we found that our potential users didn't have ready or free access to evidence-based materials that would help them in their decision-making process. So this is what the special collections look like on the Cochrane Library. They still look like this. And the Cochrane Library serves a slightly different audience to those who we were trying to make contact with in the humanitarian disaster field. So Cochrane has traditionally been seen as medical, it's been seen as UK-based and not relevant to the humanitarian aid sector. That's been told to us many times. So we needed to overcome those hurdles. On the positive side, the Cochrane Library has a massive reach. As you know, it's pretty much worldwide. And without the Cochrane reviews that we'd included in our resources, we would have very little resource at all. However, all the collections were hosted on a single site, as I say, in the Cochrane Library. They weren't searchable, and they only came to the front page after an emergency had been identified. So if there wasn't an emergency, you actually wouldn't see the collections unless you saw the whole list of all collections. And again, using this entry point, the EvidenceAid brand and value weren't recognised from this page at all. Now, very quickly, looking at the old EvidenceAid website, which was hosted by Cochrane, as I said, there was no clear brand nor value. It didn't look like EvidenceAid owned this website. It actually looked like the Cochrane Collaboration owned it. And whilst we work in partnership with the Cochrane Collaboration, we really needed to have some of our own vision and identity. We also know through the EvidenceAid Needs Assessment Survey that humanitarian aid workers don't generally go to Cochrane's website, and as I said, neither do they use the Cochrane Library. And this is because not least it's intervention-led, and few reviews include evidence other than Cochrane, other than RCTs, as Placenta mentioned earlier this morning. So we needed to see how we could challenge and change the behaviour of humanitarian aid workers looking for evidence. So we worked with Wiley Blackwell. They took on EvidenceAid as a corporate social responsibility project and provided both funding, financial funding and in-kind support. So Wiley also provided mapping and technical support to build our new database and ongoing support to make changes needed. However, just as a call for a volunteer, we are still looking for people to help us to keep our website up to date. So the EvidenceAid website was launched with a database of resources in August 2013. Included in the searchable resources are currently 166 systematic reviews, and all have short evidence summaries, and 16 reports which aren't systematic reviews. The resources are searchable from any page of the EvidenceAid website, and the prominence of the search box was actually really important to us. So we wanted people to, whatever page they landed on, they could search for what it was that they were looking for. Our brand identity and strapline are now very apparent and consistent throughout the website, and that ensures a consistent message to our users, and that's important to us. And it also gave us the ability to include links that weren't relevant to Cochrane and that Cochrane wouldn't include, but with high relevance to the humanitarian aid community. So we've got articles from the Red Cross, we have some disaster management and things, and those kind of resources. They're fairly ad hoc, and we include them as we're advised of them. So there's no kind of systematic looking for those things, but we still think it's important to provide them. So here's a screenshot of our new website. I think you can see from the word that says features, that's a slider, which means it changes every few seconds, allowing people who land on the page at different times finding something different to catch their attention. And you can also see from this that we provided a response to Typhoon Haiyan in the Philippines, and we've also got our Twitter feed going live on the front page all the time. So looking at the priority setting exercise as to what we would include in our resources was originally carried out by Mike Clark, David Tovey, who's the editor-in-chief of the Cochrane Library and who's going to be here later this afternoon, and also Bonix Kaibu, who's the EvidenceAid coordinator that Mike introduced you to earlier, and he'll talk after me. The review choices were then checked with the relevant Cochrane review group to ensure that we hadn't missed something that they would then say, no, that's absolutely not relevant. And after that, we partnered with the International Rescue Committee in the United States. And every time there are new Cochrane reviews published, what we do is we work with them to have a look at their relevance and see if they should be included in our resources. We currently check each month for new protocols and new reviews. But I'm hoping that in the future this might be streamlined, maybe by tagging potential protocols with an EvidenceAid tag in the Cochrane's information management system. But unfortunately at the moment that's not possible. So in the future we'll be partnering with other organisations, including publishers, to ensure that we have freely available evidence that's specific to the emergency and disaster field. We are currently developing materials to approach publishers to ask them to grant evidence aid free access to any materials that are currently for payment and systematic reviews that they publish. And what we'd like to hear from you, if it's possible, is are there other people that we should contact? Are there publishers that you know? Are there people that you know that would grant us free access and allow us to include their systematic reviews on our resources? So this is what the top half of our resources page looks like. I'm going to walk you through a quick example of how a user would click through the resources to a freely available Cochrane review. The Cochrane Library is a paid-for product in some countries. I don't know whether you know that, but EvidenceAid has secured free click-through access to all Cochrane reviews that it includes. So, for instance, somebody in the United States who pays for the Cochrane Library, if there was a disaster in the States, they would be able to come to EvidenceAid and click straight through to the Cochrane review without having to pay. So the next slide shows some examples of the resources. I'm going to talk about the particular ones with relevance to diarrhea prevention, management and treatment. There are headings so that the user can browse through topic by topic. There's the search facility so that you can hit your target straight away. And there are clickable links through to other types of summaries, which I'll show you on the next slide. So this is the evidence summary that we talked about, which is written by EvidenceAid, both volunteers and staff. There's a clickable link through to the Cochrane review, the full Cochrane review. There's also an evidence update summary for this particular review, which we include a link to. And at the bottom, there are some keywords on which the summary's been indexed. And what we're using at the moment are the keywords that are included in the Cochrane review. The indexing isn't as comprehensive as we'd like it to be, but that's another big job that's, maybe perhaps when we've got a little bit more staffing. We also need to figure out how to index non-Cochrane systematic reviews. So this is the end of the process. This is the full Cochrane review, the link through, and as you can see, it's just a kind of a very smooth click through from one to the other. So these are the other resources I mentioned, the non-systematic Cochrane review, the non-systematic reviews, and as you can see, they are a little bit ad hoc, but they are of high relevance to the disaster or emergency setting. They haven't been indexed, so if you're looking for them, you'd really have to go down to the other resources and just have a look through them rather than expecting to hit them with a search result. So what's next? Well, we need to increase the identification of additional resources and with some urgency develop the contextual summaries that will be most used to those in the field. And that's an ongoing conversation that we're having with a few different people. But if you have ideas about contextual summaries, please do come and let us know, because we realise that those are actually really important. What we want to do is develop a more dynamic and interactive searching interface, and while doing this, we also want to seek to redevelop and improve the website. And I know Dom's going to be talking about that a bit later. And we also need to identify, as I said before, willing volunteers who might actually help us. So what I'm going to do next is walk you through a few user stories. I'm not going to read them out to you, but what I'm going to do is just pop them on the screen for a couple of minutes. My presentation will be available online after the symposium, so you can take your time to read through them. But this just kind of gives you an idea of what we've responded to and how people have used the EvidenceAid resources. So in Japan, it was the PTSD resources that were really important, and those were translated into Japanese quite quickly after the tsunami and nuclear disaster. And this was by Toshi Furukawa from Kyoto University in Japan. In New Zealand, after the earthquake in Christchurch, our resources were searched for some kidney crush injuries. Unfortunately, the EvidenceAid resources didn't quite hit the spot with this one, but we got some good feedback about systematic reviews that were important. And what it did was a little bit like Mike talked about with hand washing, is it allowed them to pull out of the resources the relevant information that they needed to make their decisions. It also confounded to them that they were making the right decisions, and that was really important to them, even though the context was slightly different. So this was done by Michael Ardagh, Professor of Emergency Medicine in Christchurch Hospital, New Zealand. And there's also, he spoke about this at the Cochrane Colloquium in Auckland in 2012. And there's a video of his presentation on our website if you're interested. In 2011, we responded to the flooding in Thailand, and again, what we heard was that the nurses that were doing a major response to the flooding couldn't access the resources because their English language wasn't good enough, and so again, we were asked if these resources could be translated into Thai, and that happened. And that was Konkan University in Thailand. There's a Cochrane Centre branch based there. So that's how that kind of relationship formed. We've also worked with the Belgian Red Cross Flanders, looking at the diarrheal disease, and talking about how they changed their policies, and including a hygiene education component on the treatment and storage of safe water. In addition, we have just worked with the UNISDR Scientific and Technical Advisory Group, which is called STAG, to work up a couple of case studies, one on safe water with the Red Cross and one on post-traumatic stress disorder. And just a quick plug for them is that they're still looking for people who might author those case studies. And if you're interested, do let me know, and I can put you in touch with the relevant person at the STAG committee. We continue to develop our social media strategies and channels. Currently, the main social media streams are Twitter, Facebook, and LinkedIn. And if you want to follow us or join any of the groups, please do feel free. And just to make a final statement for us, the future is defined by others. What we want to do is to share our resources and knowledge with those who need it at the time that they need it most. And to be effective, what we need to do is for you to share your information, your knowledge needs as well. Because what we can't do is we can't respond to your knowledge needs without knowing what they are. So that's not quite relevant because Mike's decided that all questions will come later, but that's the end of my talk, so thank you very much.
So, my name is Bonix Kayabu. I'm the EvidenceAid coordinator. I'm based in Trinity, Dublin, the St. I'm originally from the Democratic Republic of Congo, and I have to say thank you very much for the Indian peacekeepers who are still working in DRC to try to bring the country together. Thank you for the Indian peacekeepers. So my topic today is about the gap analysis and the priorities, priority of questions for EvidenceAid. We know who are these people, and Mark, McClark, and Claire, and myself, and Birmingham with that, these are evidence team. I'm going to talk about few points. First of all, why evidence? Secondly, describe briefly what is the gap analysis and the current situation in the humanitarian sector, and then describe what EvidenceAid has been doing. And under this point, we have organized a couple of international conferences and need assessment survey, and research priority settings, and also dissemination of evidence-aid resources. So then I'm going to summarize and then finish by the vision of EvidenceAid. As it was being said before, EvidenceAid was established after the Indian tsunami of December 2004, and EvidenceAid uses knowledge from systematic reviews to provide reliable, up-to-date evidence for disaster and humanitarian crisis. The aim is to improve access to systematic reviews on the effect of interventions and actions, and not only on interventions related to health, but any other interventions which would have health outcomes. So for many businesses, they use gap analysis to determine what steps need to be taken in order to move from its current state to its desired or future states. So the gap analysis will start first with to analyze the current situation, and then to list factors that needed to be achieved in the future objective, and then it should highlight different steps that should be followed in order to fill that gap. So the current situation is that we all know that evidence-informed policy is well established in medicine and in other sectors such as zoology, astrology, and even in justice, criminal justice. But in disaster settings, despite agreement that rational